We're joined today by Dr. Michelle Wilson, who's a Phoebe Family Medicine resident, and you also treat primary care patients at Phoebe Northwest. Now we're shooting this right around the first of the year. Why is that a good time to kind of focus on our healthcare?
Yeah, so a lot of patients, or a lot of people in general, like to make New Year's resolutions. They want to get back in the gym and take care of themselves. One of the things on that to-do list should be seeing your primary care doctor. So many times I've seen patients where they haven't seen a doctor in 5 to 10 years, so now it's time to catch up, get those preventative checks in place, and make sure that you're up to date on everything.
So explain to us really what a primary care physician is.
Yes, it's a medical doctor who's either trained in family medicine or internal medicine. And generally for family medicine, we do cradle to grave care. So we take care of newborns all the way up to geriatric patients.
Now here at Phoebe, you may not always see a physician if you go to your primary care clinic. Yeah. We have other highly qualified providers, right?
Mm-hmm. Yes, we do also have APPs. So they really serve to help get a patient in the office in the event that they can't see a medical doctor. They don't have the same training as a medical doctor, but they are able to manage acute things and can also always talk to the medical doctor if they have any concerns about patient care.
Right, work really closely together.
Mm-hmm. Yes.
So talk to us about the ways that you serve patients. Why would I come to see you?
Okay, wow, a long list. So one of the first things I like to do is make sure you're up to date with your shots. Also make sure you're up to date with preventative screenings for women, mammograms, pap smears for men, colonoscopies. Also, we always look at family history. So if family history of diabetes, hypertension, we like to make sure we check your labs just to make sure that there's nothing else missing that we need to take care of.
Why is an annual checkup so important, even if we think we're fine, we're not feeling bad? Why should we come see you at least once a year?
So most, if not all, insurance companies do cover an annual visit, and that's to make sure that we're up to date so we're not missing anything for your care. And Medicare also has a Medicare annual wellness visit for patients over the age of 65, so that's a free visit for those patients as well.
So what are the primary benefits of having a primary care physician that you see regularly?
I like to say that we are the gatekeepers. So we like to navigate when a patient needs to see a specialist. We also kind of keep all that information tied together. It makes it easier for one person to know all that you need to know about a patient. So that way they can't say, oh, I see so many doctors and no one really knows who I really am. That's what we're here for, to know you personally.
The Phoebe Physicians is a large integrated network of all sorts of,
Yes.
Of providers. Why is that important, and how does that benefit your health?
It definitely benefits in the Phoebe network because we get to see the other specialist notes. So we're always up to date when a patient goes to see a new specialist. They always send to us the information of what happened in that visit and what their plan is going forward. So the next time I see that patient, I can be like, oh, what happened when you saw that specialist? What's the game plan moving forward?
So you're a resident with the Phoebe Family Medicine
Yes.
residency program. Talk to us about that training and why it is that you love being a primary care physician.
Oh gosh, I've loved family medicine even when I was a third-year medical student. The idea of that continuity of care, taking care of a patient, seeing them through every milestone, checking in on them when they get out of the hospital, or even checking on them when they're at their low points and they just need to talk to somebody. Our training includes inpatient pediatrics, outpatient pediatrics, obstetrics, gynecology, adult inpatient service. So when we have patients that come in for heart failure exacerbations, or let's say their blood sugars are out of control from diabetes, our job is to helpfully keep that under control and keep them out of the hospital in the future. So family medicine, ultimately to me, is that always knowing your patients. I think it's hard when patients, they see a million specialists and you feel like you're getting kind of like care that's kind of chopped up. A family medicine doctor is there to put it all together in one succinct story. So I can always tell that story for my patients to other doctors that need to know what's going on with them.
Well, Dr. Wilson, thank you for sharing your expertise about primary care with us and for all that you do for your patients.
Thank you.
Thank you.